Hi, my name is Perla Lansang, and today we're going to be talking about Stasis dermatitis. I've worked with several drug companies, but none of the products they make are going to be relevant for our talk today. So at the end of this module, I hope you will be able to recognize Stasis dermatitis, understand the specific cause of Stasis dermatitis, and review some treatment options for this particular condition. So stasis dermatitis is really a skin sign or a cutaneous sign of venous hypertension and venous insufficiency. What happens is the valves on the legs become incompetent, and when the blood backs up, it causes swelling, extravasation of the blood, inflammation, and then if that inflammation persists, it can cause ulceration of the skin. So stasis dermatitis, because it's caused by swelling, presents on the lower legs. It can be unilateral if only one leg is involved, or it can be bilateral as well. The skin changes of stasis dermatitis are often accompanied by swelling, oozing, and crusting, and may often be mistaken for an infection. There's a characteristic red-brown color to stasis dermatitis, and this is because this is the hemosiderin that deposits around the skin. You may have accompanying varicosity, so if a patient has varicose veins, that shows you that the vessels in the legs are starting to become incompetent, and that results in the edema of the legs. So this is a clinical picture of stasis dermatitis. You can see that for this patient, the leg is quite swollen all the way up to the knee, and there are erythematous scaly plaques all over the leg, which is a stasis dermatitis. There are certain risk factors that cause this particular condition. Some people are predisposed to it genetically. Females are more predisposed to it. If a patient is obese or is pregnant, so that impedes blood flow back into the upper half of the body. And if the patient stands for a long time, all of these conditions predispose a patient to edema. And then when you get prolonged edema, you get the stasis dermatitis. This is another picture of a stasis dermatitis, and you can see that there is this hyperpigmented red-brown plaque over the leg. What I'd like you to note is in the middle of that plaque, there is starting to become an ulcer. There's an opening of the skin, and that's what happens when stasis dermatitis is left untreated for a long period of time. This is a more severe ulcer in the setting of stasis dermatitis, and you can see the stasis changes around this particular ulcer. You'll note that both pictures were in the medial malleolus, and that is the most common area for stasis dermatitis and stasis ulcers to occur. Now, because stasis dermatitis and stasis ulcers is primarily caused by the edema, the main treatment principle really for this disease is to decrease the leg swelling. And how do we do that? You can elevate the legs, you can compress the legs. So elevation is simple. You ask the patient to elevate their legs at the end of the day using 2 or 3 pillows. However, compression needs some dressings. So the patient can either use compression garments or compression stockings, or there are certain compression dressings that we can wrap around the leg that will alleviate that particular edema. Of course, there's an inflammatory component to this condition, so topical steroids can be used as well. And then, of course, if there's an ulcer, you want proper wound care to prevent infections, and if there is an infection there, to treat that infection with topical or oral antibiotics. This is really how a compression stocking works, and it's important to understand this, and it's important to explain this to the patient so that the patient understands that this particular treatment option is the most important thing that they can do for their stasis dermatitis. You can see that the compression stockings are graduated stockings, and there is more pressure near the ankle, and that pressure eventually gets lighter when it gets to the upper part of the leg. This pushes the fluid back up the leg and allows the edema to be pushed out of the leg. When we relieve the edema, we can relieve the symptoms of stasis dermatitis. So I hope by now you are able to recognize the findings of stasis dermatitis, understand that edema is the main cause of stasis dermatitis, and we reviewed some treatment options. And really, the most important treatment option for stasis dermatitis is compression. Thank you, and I hope you enjoyed that module.